Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today let's talk a little more if you have mobility on a tooth or if you're starting to get some recession on a tooth during Invisalign or clear aligner treatment, but this also actually applies to braces treatment as well. It doesn't matter, all of the above. So if someone gives me a call and says, hey, this is happening, I'm not talking about patients, I'm talking about doctors on one of their cases, this is the stuff that I ask for. And then I tell them we're gonna put our detective hat on. We may have to phone a friend, a periodontist. We may not. We may figure it out. But this is the stuff I ask for before we meet. Number one, get a PA of the area. Sure, you can get a CBCT if you want to. I don't care. Get new perio or probing depths of the area and the area around it. I'm also going to ask for the old ones. And I'm also going to ask for the old PA as well. Get the start x-rays and the start perio charting to compare it to. Get a full set of tracking photos. Tracking photos, you should know what that is. If you don't, go into my YouTube channel, put in tracking, and read everything on what tracking photos are, as well as a full set of progress intraoral photos with articulation marks or occlusion marks. If you don't know why, go into my channel and look that up as well by keyword, as well as get some type of cephalometric x-ray or a CBCT sagittal slice. Don't care which one. I don't care about the numbers. I can tell just by looking at it. But if you want to learn it and understand it, get the numbers. If you don't know how to get the numbers, I have a lot of different companies you can work with that can help get you numbers, and I can help you interpret them. Until then, until we get all this, do not progress with the aligners. As a matter of fact, if possible, if we aren't going to be able to figure this out quickly, I recommend taking the tooth out of occlusion. You can often put bite bumps or other things on the teeth. A little more tricky if you have aligners, but and just wear the last set or make a set of retainers. But I kind of want that tooth out of occlusion if possible and not moving, and we'll figure it out. What are the most common causes? Well, usually it's because you either move the tooth too fast, and remember, you never ever take what the technicians tell you to do. You don't trust the technicians. You need to learn how to do treatment plans on your own. You need to understand what's too fast, what's right. In my personal opinion, I'm just going to say this. Remember, these are public companies. Public companies' goal is to make as much profit as possible. How do they make as much profit as possible? Well, they use as little plastic as possible, which of course is great for the environment, but it's not great for your teeth or bone to use little plastic. It's better to use a lot of plastic and to keep the forces slow and low. How do you keep the forces slow and low? By moving a little bit at a time more frequently instead of bigger steps less frequently. So I'd rather you do tiny itty bitty 0.1 movements every 5 days than do massive 0.3 movements every 14 days. Why? Because that keeps the forces slower and lower. It's better for the bone. It's better for the gums. And these type of things are less likely to happen when you do that. So that's why orthodontists do that. We never take what the technicians do. We take multiple times to optimize the treatment plan and to keep the forces slow and low. Whereas a lot of general dentists just accept what the technicians say, which is a mistake. So definitely, don't progress with the aligners. We're going to take a look and we're going to see if either you went too fast or if you pushed the teeth too far forward. Usually it's an anterior tooth. And that's the data that we need in order to do that. All right. Thanks so much.